Well, for one, this is a great opportunity to share with countries with high TB burden to let them know what the Philippines has done to address TB as one of the major communicable or infectious diseases uh, affecting our people. And today, in the Philippines, we have a TB prevalence rate of 1%, which means of a population of about 100 million, we have about 760,000 cases of TB estimated, at least by 2016. And therefore, we're looking at about 240,000 missing cases of TB. And so we are into active case finding of TB, and we're leveling up the screening, treatment, diagnosis, treatment, and prevention interventions to end the burden of TB in the Philippines. Remember, we're one of the 22 countries with a high TB burden and contributing to the 90% TB burden globally. So we are a major contributor. And so we need to put our house in order and make sure that we are able to understand what are the interventions, effective interventions, that's going to help us bring down, if not eliminate, TB in the Philippines. You know, we are very actively supported by the Global Fund. Then we have the UNFP, and then we have the USAID and the WHO. So we have many development partners supporting us in our TB elimination initiative. Well, insofar as the NCDs are concerned, remember that's also a major problem in the Philippines, in the sense that half of all of our deaths are caused by NCDs, such as cancer, cardiovascular disease, COPD, diabetes mellitus, and to name a few. And so half of these deaths caused by NCD leads to premature deaths of our people who can be considered as in their prime of life. And so this is really impactful negatively in terms of our national development goals. Remember that NCDs are not just a health issue, but also contribute to our development as a nation and as a people. If we're not able to lick the problem, then we will continue to suffer, and productivity is one of those that will be compromised. Well, we have a very, very active participation, and I'm here in behalf of the Philippine government in general, and in particular in behalf of His Excellency President Rodrigo Duterte. And we hope to be able to bring home a lot of new knowledge and information and best practices which are being showcased by the several participating countries, member countries of the UN. And also in the same breath, we are able to share our own experience and best practices so that everybody truly benefits from this congregation of public health practitioners, policy makers, public health program implementers. This is really going to be a very rich source of information and knowledge, and that will help us advance the cause of public health in the Philippines. in general, and to effectively address major public health challenges such as tuberculosis and non-communicable diseases.